Hi there, welcome back to my YouTube channel. Thank you so much for watching. Please remember to subscribe to the channel, click the notifications and like the videos here on YouTube. You can also check out the playlist for more videos on cosmetic surgery. So today I am speaking to a UK surgeon and his name is Adam, and we're going to be talking about the body lift procedure. Hi there, thank you Adam for joining me today. Please introduce yourself and just tell me a little bit about your practice.
Hi Rona, well thank you very much for inviting me here. So I'm a consultant plastic surgeon. I had an NHS practice at Charing Cross Hospital where I worked with the bariatric service there and developed a practice from there. But since I've left the NHS and now work full-time private since 2014, and I'm based in both London and Surrey in the UK. So over time I've built up this practice managing body contouring for people who have had weight loss. I've worked in both an emergency setting, if you might call it that way, where people have come over in life-threatening situations with regards to their weight, and we've done joint procedures with the bariatric team who perform a gastric bypass or something of that nature, and I remove excess skin, or as an elective situation where people have successfully lost weight and therefore are looking at contouring the body.
Brilliant.
So yeah.
Yeah, so so today we're going to be talking about the body lift. So I don't know that much about this. Would you be able to tell me, like, what is a body lift? I know it involves a lot of procedures. Can it all be done in one go as well?
Yeah, that's right. It can all be done in one go. I mean, a body lift, essentially, it comes under various different names or titles, such as belt lipectomy or circumferential abdominoplasty. Basically, it's going all the way round.
Okay.
It's going all the way around the abdomen, removing all the excess skin from the front, the flanks, and the back. And hence, that's how it's got its name as a body lift.
Okay, so would it include like a tummy tuck as well, and like a boob job done as well?
No, it doesn't include the breasts. It's just purely abdominal and back surgery.
Right. Okay. And tell me, who would make an ideal candidate for this type of procedure?
Okay, so generally we're dealing with people who have undergone, I guess you call it massive weight loss. I mean, the term massive weight loss, it's slightly grey if you want to. It doesn't really determine a particular sort of definition, if you want to call it that. I mean, they have tried to call it as people who have lost over 50% of the excess body weight that they have. Okay. But you know, it's slightly grey area. I mean, to me, I look at it depending on the type of surgery they've had. So, for instance, if they've had a gastric sleeve, then you're ideally looking at somewhere between 30-35% weight loss. Or if they've had a bypass, up to 40% weight loss would be the ideal situation. But, you know, it's extremely flexible in that regard. And really, we're looking at people who have sort of plateaued their weight particularly. Okay.
And would it include any lipo as well?
Generally, the answer to that is no in my practice. There is a lot of variation currently as to the use of liposuction. I tend to use more of a removal procedure, if that makes sense, because liposuction, in my experience, I think tends to add an additional insult to the tissues, and so therefore you can't quite get things as tight as I would like them to be, and the tissues can still remain a little bit lax. And also liposuction generally is used in areas where your body stores excess. So you've got a genetic blueprint where your body wants to preferentially store fat, and those are the sorts of areas where it works extremely well. But where the areas are as thick as the rest of you, if you want to determine it that way, then you can end up with quite sort of contouring irregularities. So really what I try and do is actually cut it out and get rid of it, and that way it has greater longevity in turn and more predictable outcome. So yeah, you know, liposuction, I have to be honest with you, I would only use it in specific areas.
Right. Okay. So I wanted to ask you as well, like, sometimes they say when you have a tummy tuck, you're not going to be able to regain fat in that area. I mean, it's probably not the case for everybody. So would it be kind of like with a body lift, would you be able to gain fat back again in the future if you was to overeat, or is it kind of the cells have been killed where you're removing
Yeah, I
the
mean,
excess?
it's interesting. I'm asked that a lot. Will it come back? Sadly, the answer is unfortunately. Yeah, I mean, the body never forgets. It's one of those interesting
Yeah,
things. There's a blueprint in everyone's brain, as I was saying, where your body
yeah,
wants to preferentially store fat, and that's why when you
yeah.
walk down the street, you see all sorts of different shapes of people. Some people with larger thighs, larger bottoms, larger flanks. That's an inherited phenomenon, and that's where your body just wants to store, and it never forgets. And so, even though you could say I've removed 1 billion fat cells, there's still 1 billion
Mm,
left, and it will still go to that area, sadly. So yeah, it does involve enabling yourself to keep at the weight.
mm. And would you say like a lot of actual weight would be actually removed? Say if I was maybe 15 stone or something like that, would I expect to see quite a lot of weight loss, or is the skin
Yeah,
not that heavy?
yeah, it depends on how successful, in inverted commas, you have been in your own way of losing weight.
Mm,
Obviously, the more weight you lose, then the less fat and the less weight there is to remove. But invariably, I mean, particularly if you're doing the circumferential abdominoplasty, that's still a lot of tissue, and so by definition, the excess skin has been created to cover the size of your torso beforehand. And so,
mm.
if you're going to put figures on it, probably anywhere between about 4 to 7 kilos usually.
Okay.
But that's in the elective situation. As I say,
Yeah.
when I was doing the occasional sort of emergency situation, I mean, the most I've ever removed has been actually 27 kilos,
Okay.
which is a considerable amount. And
Mm,
but that was an individual prior to them having their
mm.
weight loss effect.
Yeah.
The bypass was being done at the same time, and I was removing the excess skin because it was so cumbersome and so inhibiting
Mm.
in their physical activities that it had to go.
Yeah. Brilliant. So tell me, how difficult would this recovery be? How long is the process going to be in theatre for a start? How long is the surgery going to take? And what kind of recovery for this? Is it going to be really painful?
Yeah, no, it's surprisingly not as painful as you might think. I mean, everyone judges pain by the size of the scars, but of course, in
Mm,
reality, it's more or less skin deep. The discomfort that you can sometimes get is if the muscles at the front, the rectus abdominis muscle or six pack, which we've all got somewhere, has to be plicated or brought together.
okay.
Usually that's something that happens when there's been specific strain on the tummy muscles. And I have to be honest with you, that's predominantly things like pregnancies that tends to
Yeah.
make the muscles separate. But if there has been a radical change in the size due to your intra-abdominal inside you getting much, much bigger, then if the muscle is separated, yeah, they need to be brought back together. And that is the part that can be uncomfortable. But if not, then then it is a matter of just removing the excess skin, which isn't as uncomfortable as you probably think. As I say,
Yeah.
estimating by the size.
Okay. And it can all be done in one go, yeah?
Yeah, that's right. It can all be done in one go. I mean, it's a long op. It takes about 6 hours or so because you have to be turned to get access to both sides,
Yeah.
and so that increases the time scale.
Mm,
But your recovery generally isn't that bad.
okay. Tell me what complications somebody could expect. I don't really think these things would just be plain sailing for everybody. What side effects could you expect to be quite common?
Well, generally, we classify side effects as sort of specific ones related to where the operation's been done, and general ones in terms of your well-being.
Mm,
Specific, you're talking things like wound breakdowns. The trouble is that no matter what position you put yourself in, something's under tension. And
yeah.
the place that's likely to get most under tension is your back. And if you think about it, that's simply because of, say, as we're sitting here now, the angle of our back to our thighs is about 270 degrees. Okay. this and the smallest angle it would ever get will be 180 degrees, where it's flat and to the surface. The opposite is the case with your tummy. As you're sat there, 90 degrees, the angle of your tummy to your thighs, and then up to a maximum of 180 degrees, you see. So it's invariably the back that gets the most problems. And so as such, I tend to use specialist suction dressings on the back for the first 10 days to help to support the back wound and to reduce the tension, basically. So wound separation is one of the big things, okay? Infections, fluid collections, and classically we call those seromas. That's blister sort of coloured fluid, because again, it's the big surface area that's been operated over. So your body tends to put out that inflammation fluid, which is the serous fluid, and it can collect under the skin. Okay, it does require to have what we call drains, which are soft silicone tubes which draw out that fluid, and hopefully your body will then settle itself down and they can be removed, ideally before you go home. But occasionally we do have to send people home with the drains in. Yeah. And that's fine. They're fairly easy to. They are easy to look after, if I'm honest with you. And then specific, and then general things. So those are the specific general things. One of the key ones is thrombosis, clots in the calf. Okay, because your mobility has been reduced, you've had a fairly long op, then you do have a particular risk for getting clots in your calf, and so usually we do send people home with blood thinners, okay, to help them over the first 10, 12 days or so. Okay, but apart from that, those are the more generalized potential risks, really.
Okay, that's great. So last question for you, Adam. Can you just tell me what is your aftercare like, your post-op care? What can somebody expect after their procedure? You know, garments and things like that, and how many appointments do they get to see you following up?
Sure. So basically, the important thing is that it's an open appointment system. We do have set times to just put a bit of structure on it, but it's open, and for when people, if they ever want to contact us or if they have an issue, then we always encourage that contact. But if you're going to sort of put it and stipulate it in specific terms, then yes, if you've gone home with your drains in, we have a practice nurse that will be regularly in contact with that individual to make sure that things are going fine, find out how much the measurements are, and then remove when appropriate. Then they're seen at 10 days because there will be stitches in the belly button or the umbilicus that will need removing at that stage, but all the rest of the stitches are all dissolving. Okay, and then I would see you at 2 weeks personally. Okay, and we'd assess the wounds, we would assess how things are going. I then usually suggest that you start applying a silicone gel to the scars, which has been shown to really help in terms of scar healing. The binders and compression knickers, those are things that we generally provide for you, and you need to wear them for up to 6 weeks post-op. Okay, so they're there to give that bit of support, bit of compression, okay, just to minimize the swelling and help you to be essentially more mobile and more comfortable. And then after the 2 week stage, see you at a further 4 weeks. Make sure the scars are settling down, and at that stage, generally, you'll be able to get back to normal activities by then.
Good to go.
Good to go. Well, thanks so much, Rhona. Very nice to meet you.
Thank you so much. Thanks for joining me today. Okay. Bye bye.
Pleasure. Bye bye.